very important if we would like to innovate on one hand a service. It could be a health service, it could be a social service, a care or a cure of course as well. We need a lot of technology to be more efficient. But this technology have to be very well defined, and if it's a new technology we have to prove if it could be really used, if this technology is really the most effective one, the most efficient one. So if we want to define what kind of technology we need the end users, one of the most important stakeholders. We need the physicians, we need all the professionals taking part in the service, providing of the service. And also very important to know a lot about the technological possibilities. So we need research, we need universities, we need academia. This is another very important sector of the stakeholders. And of course we need the public as well. Public is one of the biggest care provider, one of the biggest payer for the care, and public is one of the bigger procurer. Even if I mention the payer, public is one of the payers, of course private insurance companies could be also important players in this market as payers. So if we are talking about the different stakeholders, we mustn't forget them as well. Also very important if we are talking about the business who develop the innovative products, and in a lot of cases they are not only products but complete services. A lot of major and even small and medium companies develop special equipment but also offer service together with the equipment. And very important if we are talking about the innovation, to mention the whole production and distribution chain. So there are very important stakeholders who are trading, handling the new products. They also have special needs. And if we put together all the stakeholders who might be interested, we can define a new innovative service or product which is acceptable to a certain level to all the stakeholders. Of course, one of the most important stakeholders are the end users, or the most important are the end users. So we want to provide them an accessible health service and health care service together with other services of HoCare. But we also would like to find what are the most important needs of them. And sometimes those people who are at home, because of different reasons, they are very interested about the different complications of the situation, why they are at home. It could be an acute problem, it could be a chronic problem, it could be just age. But because of this basic situation, they might have some complications. For example, somebody suffering from diabetes could suffer or could be threatened by different cardiovascular problems. And these people are also very interested, and they need some kind of solution to prevent to have these complications. So we don't have to concentrate only on the existing problems, but also to prevent something.